Hello, Alicia. Good afternoon. My name is Enrique Castellanos. I'm with the NSU College of Pharmacy. On behalf of the College of Pharmacy, I'd like to thank you for giving us the opportunity to interview you, as well as APhA-ASP student chapter also thanks you very much. And in celebration of Pharmacist Month here in Florida, I would like to, if you have a few moments, ask you a few questions about pharmacists and their role in healthcare.
Thank you, Enrique, for having me. It's an honor that you chose me as one of the interview candidates. It's my pleasure to give my thoughts on pharmacists and their role in healthcare. My name, a little bit about myself. I am Alicia Diaz. I am a practicing licensed physical therapist assistant in the state of Florida. Have been for the past 13 years. 10 of those years I practiced patient care in hospitals, and I'm currently, these past 3 years, have been working at a school. I'm an assistant professor at a PTA program at the Praxis Institute, and I'm also their director of clinical education.
How would you feel about a pharmacist prescribing you a medication for a minor infection such as strep throat or even the flu, and being able to treat you there at the pharmacy after once the infection has been confirmed?
I think that's a wonderful thing with a lot of people who are uninsured or maybe have high copays. And with primary care being swamped right now, the fact that a person can go to a community pharmacy and receive care and receive the medication that they already need from a pharmacist, I think it's wonderful. I mean, you guys are doctors, so why not? I think for minor things, strep throat, flu, fever, anything topical, dermatitis, I think it's wonderful. I think it's great.
Can you describe some services that a pharmacist can provide for you as a patient?
Well, I have from my local community pharmacist, I have received the flu vaccine multiple times this past 2 years. I've also received vaccination boosters, specifically MMR. I have also received a consultation on medication that I wasn't sure of on how to take or what the side effects were, because my doctor wasn't very clear. So I value my pharmacist very much.
During the current pandemic, how has access to a pharmacist helped you?
Prior to in March, when the pandemic happened, I actually received my flu vaccination. And then during the pandemic, I was able to receive an MMR booster from my pharmacist. So access to a pharmacist has actually been way easier than getting access to a primary care physician at this point.
A lot of them have been closed.
Exactly, because they have been closed, or because the scheduling, they're not letting all the patients come in. Exactly. So having access to my pharmacist has been a lot easier.
Okay. The next question I have here is, how has working with a pharmacist in your professional field help elevate your patient care?
So 2 examples come to mind. When I worked in the hospital, especially when I worked at West Kendall Baptist, there was always a pharmacist on the floor, and we worked in interdisciplinary teams. So we would have interdisciplinary teams meetings, and it was very interesting to hear in those meetings how certain medications, what the side effects of those medications were, and then me trying to treat the patient, it would that's why this is happening moments. And then in the education aspect, I actually collaborate because we do have a pharmacy tech program. So my students collaborate with the pharmacy tech program when I'm teaching wound care. And the way that we do the collaboration is I teach my students how to provide the wound care for the patient, and the pharmacy tech students give or compound the creams and the ointments so we can practice how to apply those medications. And they come in and actually give my students a brief on what the side effects of those medications are, and it helps my students understand why they are applying those medications. So I'm all about it.
I think that's really cool that your school has both pharmacy and the physical therapy, both sides
Yes,
of it.
and their pharmacy tech program just got accredited by ASHP actually.
Great.
So kudos to them. But yes, I do a lot of collaboration with them. They also prepare IV bags for me, pretend obviously. So when we are in the section where I teach my students how to take patients out of bed with line management, I actually have IV poles, and it helps that I have an actual IV bag that weighs tied to the IV pole, so then my students can understand and learn how to manage those lines accordingly.
Describe an interaction you've had in the past with a pharmacist.
Sure. I always tell my students that we work in a team environment. We're constantly dealing with doctors, nurses, PAs, nurse practitioners, pharmacists, pharmacy techs, and if we all work together for the common goal of the patient and getting that patient better and advocating for that patient, I think the patient outcomes are a lot better. I have seen the outcomes of patient care go higher when everybody works together for the common goal. Whether it's end of life, whether it's in the beginning of life, or whether it's in the interim. I think everybody needs to work together. As a new graduate of pharmacy, my advice to the new graduate is to have patience. Have patience with the community, have patience with the people that you are dealing with, especially if you're going into a community pharmacy or retail pharmacy, because of the instant gratification that people have, since we have access to cell phones, since we have WebMD, people that think that they know more than you. So just kind of be patient in that aspect. If you're going into the realm of hospital-based, my advice to that pharmacy new graduate would be, again, have patience with the doctors and have patience with the nurses, because a lot of doctors really don't know what you guys can and cannot do. And don't get frustrated. Flip the coin and kind of take it as education. Educate your nurse, educate your doctor that you're working with on what your role is and what you can and cannot do. And I think if you take it upon through that way and you go that route, they will gain respect for you, rather than if you go the other route and be a little bit abrasive, or how does he not know? Well, sometimes, believe it or not, they don't. So, or they don't know that one medication is going to counteract the other. So just kind of educate them in that aspect. And I think how you approach it and what your body language is and how you speak to them, I think it goes a long way. So that would be my advice.
Very important. Patience.
Yes, patience.
So for some recent news, how would you feel about the newly acquired ability of pharmacists to immunize the pediatric patients starting as young as 3 years old now?
Immunizations, hot topic. I am for immunizations. I think that I think it's a wonderful thing. I think that maybe the conflict that would be there, that I could foresee happening, is not so much from the physicians allowing you guys to give the immunizations. I think it would be from the parents trying to sell them that you're not a doctor, you're a pharmacist, and they just kind of, their perception of that is, it is, you know, they just see a pharmacist working behind Walgreens counter, and then that's all they see. So I think there it would be, again, educating the parent and letting them know that yes, I am a doctor, I am able to give immunizations, I'm able to, you know, I have knowledge of what the medications are, I have knowledge of what the side effects are, I have knowledge that immunizations do work. So I think that would be the only conflict that I see. But as far as knowledge that the pharmacist is competent in doing it, yes, by all means, a pharmacist is more than competent in doing it. I think they probably would do better and hurt less if with a pharmacist versus a doctor or a nurse practitioner or something like that.
Yeah, it's going to be very important to educate our patients.
I think it's there.
Not have conflict between them.
Correct. So again, I think it just comes down to education of the parents, and I think if you win over the parents, it'll be fine. And the person also that can help, that would be an asset in the education, is the physician. If the physician has a pharmacist that they have a close relation with, or has a pharmacist maybe in the pediatric office already, I think that's going to help a bunch. Because I think the doctor there, or the PA, or the nurse practitioner can kind of upsell the pharmacist, and that will work. It's all how you sell it. Unfortunately, healthcare is a business, and it's what I have learned in my 13 years is how you sell it and how you present the product is how the patient or the client is going to respond to what you're doing.
Great. I loved all your answers. Thank you very much
for
giving us this opportunity to
do this.
Thank you on behalf of the College of Pharmacy here at NSU and the APhA student chapter here at NSU as well. Good afternoon, Anthony. My name is Enrique. I'd like to thank you for giving me the opportunity to interview you today. I'd like to thank you on behalf of the NSU College of Pharmacy and our American Pharmacists Association student chapter here at the school.
Thank you, Enrique, for allowing me to do this interview with you. My name is Anthony Diaz. I'm an IT professional and also a law enforcement professional.
Great. I'm glad to have this opportunity with you today. We're just going to start off by asking you a few questions about pharmacists and healthcare in celebration of Pharmacist Month here in Florida. So again, thank you very much. So the first one we have for you is, would you feel comfortable with a pharmacist prescribing you a medication for a minor ailment, such as like a skin rash, or if you come with strep throat or something for the flu, things like that?
Yeah, I'd feel very comfortable. I've had it done in the past, and I have no problems with the pharmacist applying any type of minor creams or shots in order to improve my health.
Great, great. Can you describe some of the services that you may know of that a pharmacist can provide to you as a patient?
Yeah, immunization, consultation, medication interactions, things like that.
Great. Can you describe an interaction that you may have had with the pharmacist at one point in the past?
Medication that was prescribed to me, several medications in fact, and they were able to advise on the interactions between both medications and how they should be taken and at what times, and with meals or without meals.
That's great. That's good. What advice would you give to future pharmacists that are entering the hospital or the community setting in terms of like the workforce?
I'd say have a lot of patience with the population as it's growing older, and everything that's explained in layman's terms so as they understand on how to move forward with their medication.
How would you feel about the newly acquired bill that passed that allowed pharmacists to immunize the pediatric population as young as 3 years old? And do you think they'll be qualified for this task?
Just like any professional that is trained and certified by the state or a governing body, with them providing that service.
Great. Thank you very much. Again, I'd like to thank you for giving me the opportunity to interview you, and I'd like to thank you on behalf of our school and our student organization, and thank you for coming.
Thank you for having me.
You're welcome. Good afternoon. Thank you for giving me the opportunity to interview you today. I'd also like to thank you on behalf of our school, the NSU College of Pharmacy, and the APhA student chapter at our school. If you have a few moments, we can go through some questions. This will be, just a nice little conversation. These questions are going to be around pharmacy and healthcare in celebration of the American Pharmacist Month here in Florida.
How are you? My name is Dr. William Munoz. I am a pediatric gastroenterology. I'm the director of the Division of Pediatric Gastroenterology at Nicholas Children's Hospital.
So the first question we have for you today is, how would you feel having a pharmacist prescribe you a medication for something like a minor ailment that you can get tested and treated for there at a community pharmacy, so such as like strep throat or the flu?
Well, working with pharmacists for over 30 years, I have seen the caliber of their education and their knowledge of pharmaceutical drugs in the help and the care of our patients. I've always felt that they've been a team player in educating and advising physicians in proper pharmaceutical management.
Okay, and the next one is, can you describe an interaction you've had with a pharmacist in the past?
Well, being at Nicholas Children's Hospital for over 30 years, I've had the pleasure of working side by side with pharmacists in the delivery of care in our patients. At the hospital setting, it's always been a team effort, and their knowledge and their background has always been a positive attribute in patient management. I've had excellent rapport with our pharmaceutical doctors.
What advice would you want to give future pharmacists that are going to be entering the hospital environment to work?
To be able to work with doctors of pharmacy is a true attribute for enhancing patient care. The team effect, the team protocol brings the patient care to another level. I highly respect and feel that their contribution to patient care is vital.
How has working with a pharmacist in your professional career helped elevate your patient care?
Quality in patient care has always been a team effect. Not only are pharmacists and doctors of pharmacy involved in the care of patients, nurses and ancillary care personnel have always enhanced the team effect, and the pharmaceutical approach is always enhanced the outcomes of our patients.
How do you feel about the new opportunity that pharmacists now have, where they can now immunize the pediatric population here in Florida?
I feel that the pharmacists are very capable and prepared to immunize the pediatric population, as ancillary adjuvant healthcare providers in this overwhelming task that needs to be addressed. Physicians alone cannot do it.
Thank you. That's good to hear. It's good to see that we're seen as equals, and we're all kind of just working together for the same goal of the taking care of the patient.
Your training is exemplary. Your training has elevated you as a team member in patient care completely.
Thank you. So thank you very much for having giving me the opportunity to interview you and taking the time out of your busy day. Thank you for coming. And again, I'd like to thank you on behalf of our NSU College of Pharmacy and our American Pharmacists Association student chapter here at NSU as well. Thank you again.
My pleasure. Thank
Thanks.
you.
Hello, Teresa. I'd like to thank you on behalf of the NSU College of Pharmacy and our student organization, the American Pharmacists Association. Thank you for coming and taking the time out of your busy day to come and allow me to interview you. This is in celebration for American Pharmacist Month here in Florida, and the questions will be centered toward pharmacists and their role in healthcare and any experiences you've had and interactions and such you've had with pharmacy in general.
Hello, my name is Teresa Yorin. I have a daughter. She is 8 years old. I studied education. I have my master's in curriculum and instruction. I was a teacher for about 5 years. And then I became a food broker and went into the family business, and I've been doing that for the last 9 years.
Do you feel comfortable with a pharmacist prescribing you a medication for a minor ailment, such as a strep throat or even a bigger infection like the flu, if you were able to get tested right there at the pharmacy?
I would feel comfortable as long as I've built a relationship with that pharmacist, meaning that I've gone to see them more than once. And I think that takes time, because in the past, in my experience, I've had multiple pharmacies where I really haven't had any interaction with the pharmacist. But recently I was able to find one area that I've been going to, one store, and the pharmacists have been very informative and given us a lot of information, and they have a lot of follow-up.
Yeah.
So if it's that, then for minor things it would be very helpful, so I don't necessarily have to always make the appointment with the doctor when it's
Right.
something that I would just need to confirm and get a medication for.
The next question is, what kind of interaction have you had with pharmacists in the past, whether for you as a patient or maybe for your daughter?
Well, I've had some negative interactions with which it's not clear to me if it's been the pharmacist or somebody just working at the pharmacy. That's where I guess the confusion might arise.
Yeah.
Where I wasn't sure what I was supposed to do with the medication, and they told me that they would call me back, and there was never any follow-up on. And then now recently that I've found one place that we've been going to for our prescriptions, they call us back. It's very easy to contact the pharmacist and ask a question. And when they give you the medication, they don't just give it to me. They go through what the medication is, what to expect.
That's really good.
If there's going to be any side effects or the interactions, and they ask me more questions, which then also helps me think what the questions that I might have to ask them.
Right. That's very good. What kind of pharmacy services do you think that a pharmacist can provide for you as a patient?
I guess if I was, having flu-like symptoms and I could go there to get a flu test, that would be easy, or something like that, strep throat as well, or if I have any skin problems, a skin irritation, and I have a question about that would help. And for like minor things that I know that you've gone through, that okay, I just need a little more information or confirmation of what I have so that I can get some medications and ask some questions. Yeah, and you've kind of touched on that, but the more, the pharmacist telling you about side effects and possible interactions and what this medication should do, that would fall under counseling, medication counseling for patients. And that is something that is in fact required by law that pharmacists have to do. The thing is, sometimes the companies kind of get around it, the community ones, by just having they give you a sheet of paper with your medication bag, or when you put the credit card machine, it'll say yes or no to counseling, and you sign. And you don't read it.
Yeah. So there are some pharmacies that are more personal, and those are the ones that I think are going to have better quality of care and be able to take advantage of prescribing and things like that, because that relationship that you have.
And that is important because in our busy lives and our schedules, we're going to be given the pamphlet with all the medication, and responsibly we should read it all.
Yeah.
But it's a lot better to have that personal interaction with someone where they can go over just a couple tidbits on the medication, what to expect, what side effects to look for, and then it just brings it to the forefront of your mind, and it makes you pause for a second.
Yeah.
instead of just, you're going to get your medication and move on with your day.
Yeah. What advice would you want to give future pharmacists that are going to be entering the community sector, such as a Publix or a Walgreens, and then even the hospital setting?
It goes back to what I was saying.
Yeah.
Learn to speak to your patients or your customers, to who you're working with, in layman's terms, in a way that they can understand you.
Yeah, that's very
important. Thankfully, I don't have anything that's chronic where I have medication where I have to take regularly. But a lot of people do, or somebody that just found out they did, and they have a lot of questions, and maybe they don't even know what to ask.
Yeah.
So being upfront, giving people actually some time to think, and then come back to you with questions. So giving them that opportunity would be very important. Yeah, people skills and communication.
Of course. And how do you feel about the new ability of pharmacists to be able to immunize the pediatric population, that is the younger children, starting specifically at 3 years old and up? Do you think that pharmacists are qualified for that kind of immunization?
Well, since my daughter's 8, so we've already gone through the majority of her vaccines. That except our regular flu vaccines that we do yearly. If I am made aware of what are the qualifications that a pharmacist has, just like when we go see the doctor, the nurse is usually or is the one that gives the vaccines. You don't necessarily see the doctor for the vaccine. And I've built a relationship where I know which pharmacy I'm going to and who the pharmacist is, and they have a record of what our vaccine history is, then I would feel comfortable with it. I don't necessarily know if I would feel comfortable going to just a random store or retailer, and I don't really know them, and to give the vaccine. Also that they're able to answer the questions that we would have. I think it is a positive thing because it would help with getting a lot more people vaccinated in a more timely manner, because sometimes it is difficult to get the appointment, because even though we go to the doctor, we still have to make the appointment to go get the vaccine.
If you have children, you have to go.
Makes it a little bit more convenient, so that would be a positive thing.
So I don't know if this has been made aware to you, but while we are in school, we are trained to immunize patients. Pharmacists, when they graduate and they get their pharmacy license, they're required to have an immunization component to that license, and they're required to continue to recertify that part of their license if they want to immunize this new pediatric population and immunize the general population. So it is something that they do have to continue to practice. They have to continue to get hands-on training for if they want to continue to immunize.
So knowing that as a mother, that makes me feel more comfortable should I decide to do that.
Yeah, that's good. Well, thank you. Thank you for coming again.
No
thank
problem.
you for taking the time, having me interview you here today. It was a pleasure to interview you today, Teresa. Thank you very much.
No problem. Thank you.
You're welcome.